This conference will now be recorded.
So hello everyone, welcome. Thank you so much for being here today for Paradigm Medical's education webinar on axillary web syndrome, or also known as cording. We've had so many inquiries from fitters and other medical professionals across the country regarding this topic. So I think it's going to be very interesting and a very good one. Education is so important. So I'm very happy to see all of you here today investing in yourselves. So bravo. My name is Jennifer Wang. I'm the president of Paradigm Medical. We are a medical products distributor that has been servicing Canada for well over 25 years. We specialize in post-mastectomy, lymphedema, and orthopedic footwear and foot care products. We are the exclusive Canadian distributor of American Breast Care products. American Breast Care is dedicated to helping all women lead fuller lives after breast surgery, and as such has the largest selection of post-mastectomy products on the market. We are very proud to be representing the brand here in Canada. So a little bit about Paradigm. If you ever need to contact us, here is all our contact information if you'd like to learn more, or if you have any questions or would like to set up an account or anything of the sort. Here's a picture of the team. This is from our summer. We usually do a little gathering. Everyone looks happy and we're enjoying the sun. So your presenters today will be myself and France Foster, who's our education specialist. France has been in the mastectomy business for well over 20 years, so she's just a wealth of knowledge. So if you have any questions, don't hesitate to ask. A couple little housekeeping things. Please mute everyone. If you can just mute your devices to avoid any background noises that may be distracting. And if you have any questions, feel free to use the chat function. It's a little dialogue box and it's called chat to ask your questions. France or I will be monitoring it. So we will be sure to have all your questions answered. And with that, I will pass it over to you, France.
Thank you so very much, Jennifer. So today's webinar consists of these topics and talking points. So it includes the definition of AWS, or axillary web syndrome, its prevalence, its symptoms, its causes, any associated risk factors, how to manage AWS, what your role is in helping your clients, and also we're going to talk about products to help manage the pain. We just want to mention that this webinar is not intended for the purpose of providing medical advice. It's for informational purposes only. And any questions related to actual medical advice should be addressed to a professional to professionals in the medical profession. So in these photos, you'll see different variations of what axillary web syndrome looks like. One has multiple cords versus the other on the right has a single cord. So we'll talk about the differences. So what is AWS? It's also called not just axillary web syndrome, but it can also be known as cording, tethering, or banding. It's a condition that can happen in the arm, the armpit, the trunk, or the breast, and it can occur after surgery and treatment for breast cancer or even melanoma. It manifests itself in the form of thick or thin bands or cords. It also most frequently becomes symptomatic between 2 and 8 weeks post-operatively, but can also develop and recur months to years after surgery. Why does it sometimes get diagnosed as late as 8 weeks or more? Well, the late presentation of AWS could possibly be due to underdiagnosis by patients who don't realize it's a condition that can be treated, and also by providers in the non-rehabilitation field who are not familiar with this condition, which results in delayed treatment. So it's something that by raising awareness about it, I think we can help that become a better statistic. AWS can present itself as a single cord or multiple thin cords in the subcutaneous tissues of the ipsilateral axilla. Ipsilateral means the same side of the body where the surgery occurred. The cords can extend variable distances down the ipsilateral arm or chest wall. So it can actually extend itself all the way down to the wrist in some cases. It is one of the most common but under-recognized post-surgical complication in patients that undergo breast surgery. There are actually very few studies that have been done, so these usually only count a small number of patients, at least so far, but we did find a few studies that talked about it, so we'll talk about that in the next slide. So recent research in Alberta suggests that 1 in 5 people will develop cording after breast surgery. The incidence of AWS has been reported to range wildly from 4 to 8%, depending on the duration and frequency of post-operative follow-up and the type of axillary surgery, with the majority of studies reporting AWS occurrence within 8 weeks of breast surgery. Excuse me. So when a sentinel lymph node biopsy has been performed, it seems that the occurrence of AWS is approximately 20%, as opposed to when it's a dissection of one or multiple axillary lymph nodes, the occurrence of AWS is higher, between 40 and 72%. AWS prevalence, it's not always visible. And it can go away on its own. Sometimes it can take 3 to 6 months, but it can also persist chronically. This actually highlights the fact that the healthcare professionals and patients need to be educated on the recognition of AWS and to initiate early intervention strategies, which can include wearing a postoperative garment. It's especially pertinent due to the potential detrimental effects of a reduced range of motion and pain that can affect the arm and the upper extremity function. Some of the symptoms of AWS include dull, aching pain and tightness, difficulty in raising the arm above the shoulder, inability to fully extend the elbow, postural impairment, a feeling of tightness in the axilla, numbness, prickling and burning dull ache. It can also create limited shoulder range of motion, which can impede day-to-day activities. It can cause functional impairment of the shoulder joint. It can cause psychological problems and also impair the quality of life. The cords frequently result in painful shoulder abduction and limited shoulder range of motion. So that is one of the most common symptoms. As far as the causes, the actual causes of cording isn't completely really understood yet. It could be caused by lymph or blood vessels that are clotted with fluids or that became inflamed after they're damaged by surgery or cancer treatment, usually by radiation or chemo. And it may even be caused by the cancer itself. It's also possible that the trauma from surgery against the connective tissues that can cause inflammation and scar tissue, they actually develop alongside the lymphatic vessels, blood vessels, and nerves. The scarring can spread down the fibers of the connective tissues, causing cords to form. This may actually extend all the way down to the wrist or the thumb. And again, it brings the important point that wearing a post-op or a compression garment can help prevent or reduce scar tissue. Thereby, it may actually help prevent severe pain due to cording. Next, we're going to talk about risk factors. So the main risk factor for AWS is having breast cancer surgery that includes the removal of lymph nodes, which is ALND, which is the axillary lymph node dissection. Women who undergo a sentinel node biopsy were 68% less at risk in comparison. So the more involved the surgery, the higher the risk. While it doesn't happen to everyone, AWS is still considered a fairly common side effect or occurrence after lymph node removal. So when a person is experiencing these symptoms following breast surgery, it's important that they talk to their physician. AWS can cause a person to not use their arm the way they should, and the goal is to get them the help they need to be as comfortable as possible during the recovery period, and also recommending to them to wear a postoperative garment, which can have a significant and positive effect on recovery. There are other risk factors as well, which include being younger. So there are several studies that have reported a younger age as a risk factor for AWS, meaning an age less than 55 years old. So it's considered to be a significant risk factor. Being underweight, so having a lower body mass index. When a person encounters healing complications, and also the use of adjunctive therapies, which is another treatment that used together with the primary treatment. So anything like radiation, chemo, hormone therapy, all of those things can become a risk factor. So when a person is experiencing these symptoms following breast surgery, it's important that they talk to their physician. Again, it can cause that person to not use their arm the way they should. So talk to a physician as soon as possible, and stretching and flexibility exercises under the guidance of an experienced therapist in this field. Not everyone knows of this condition, so you have to find a therapist that is knowledgeable. This is one of the best ways to resolve the condition and stop that pain. If it's left untreated, AWS may not only be painful, but it may also affect the use of the arm, its range of motion, while also impairing the patient's mental health. Let's talk about the different types of treatments available for AWS. So some very simple techniques such as scar massages, stretching and flexibility exercises, manual therapy and massage, range of motion exercises, and an interesting one is myofascial release techniques. This is a different from massages. It's a type of gentle, constant massage that releases tightness and pain throughout the myofascial tissues. And that healthcare provider will first locate trigger points or knots in the facial tissues, and then they'll gently apply pressure until they feel the tension release. This helps to reduce the buildup of scar tissue. It relieves itching. It stimulates blood flow, which in the end improves flexibility, allowing the skin to feel less rigid. It helps reduce swelling and redness, making the skin appear less aggravated and hence create a flattened appearance, and also helps decrease numbness and regain feeling in the area. So it's a very, very, very valuable technique. Then there is also manual lymph drainage. Just waiting for the next slide. I'm not seeing it on my screen here. So manual lymph drainage and complete decongestive therapy. So I'll just explain these a little bit. So manual lymph drainage, again, is different from myofascial release and different from massages. It's actually a very light skin stretching massage that helps promote the movement of lymphatic fluid out of the swollen limb. and it's not to be confused with traditional massages, which address tissues. MLD especially focused on the lymph vessels to help the flow of lymphatic fluid. So therapy is applied to the unaffected areas first, which makes it possible for the fluid to move out of the affected area or decongest the area. And it helps open the remaining functioning lymph collectors and move protein and fluid into them, as well as to help speed up lymph fluid flow through the lymphatics. And MLD is actually a recommended component of CDT, so it's completely part of the complex decongestive therapy program. So it's used in combination with other treatments. MLD in isolation on its own is effective, but it's a combination of the parts of CDT makes it an optimal program. So complete decongestive therapy has been shown to be effective in reducing lymphedema volume and improving quality of life and patient mobility. So it includes manual lymphatic drainage, compression therapy, which is usually bandaging of some form, and exercises, skin and nail care, and also self-care management and training. So it's a complete program to address any patients that may also be suffering with lymphedema. Then we also have other treatments available, such as application of moist heat, always to be done in moderation, pain medication, and low-level laser therapy. So this is a technique that some therapists may use. It's a handheld laser device that helps to reduce pain and soften scar tissue. And the benefits is that it helps to reduce pain and inflammation, augmenting tissue repair and promoting regeneration of different tissues and nerves, and also preventing tissue damage in situations where it's likely to occur. And finally, wearing the appropriate bras and prosthesis is also an excellent way to help manage AWS. So while AWS isn't completely preventable, so we're talking about what can we do to prevent this condition, it may help to do stretching, flexibility, and range of motion exercises before and immediately after any breast cancer surgery, especially when lymph nodes are removed. So again, you're looking specifically for a therapist who is familiar with this condition, and they will give the patient some very specific exercises to do. And in terms of prevention, also wearing a post-op or compression garment helps to prevent swelling and scar tissue formation, so which in turn may end up reducing the incidence of AWS and its complications. So we can't stress that enough. I think there's still a lot of awareness that we need to raise about that. So your role as a health professional, excuse me, is to help raise awareness and inform pre-surgical patients that they should be fitted with a post-op garment, and that during your appointments with a post-mastectomy client, you should listen for clues that they might be experiencing axillary web syndrome. If you do suspect that they have this, recommend that they contact their physician as soon as possible. And again, we also always emphasize to not give medical advice, but also always refer them to a physician or a health professional. How do we help patients manage the pain? Well, there are some product features that you can look for when patients have AWS. You want to provide with products that have soft fabrics and are well lined for a comforting feeling. Also products that are non-restricting, so as to avoid pressure on sensitive areas. Also recommend supportive and properly fitted bra and breast prosthesis to prevent rubbing or chafing. It's really important to emphasize that when a person is not properly fitted, not necessarily not properly fitted, but also let's say they're weight changes or there's some significant changes in their body, that after some time, that bra or prosthesis doesn't fit well anymore. So this can cause shifting and cause discomfort. So it's really highly recommended that they schedule just a fit check every 6 months or so, or if there's any significant change in their weight.
We have a couple questions from Linda, Franz, so I'll just address that now. Number one would be, wouldn't the laser be contraindicated with patients with cancer? And I think the answer to that is it depends. You'd have to speak with the health professional who's monitoring that patient's treatment. What we're mentioning in the slide is just treatment options that are available. But I think it really depends on the patient's individual health situation in order to know what sort of the best form of treatment would be for her.
Also at this point, the patient probably has finished their cancer treatments when they are looking for these type of treatments. So yeah, as Jennifer said, you need to, a professional would have to be involved in that decision.
And then her second question is, when you talk about post-op garments, are you talking about compressive bras or compression arm sleeves? So post-op garments, we're talking about right after surgery. We're talking about the compression bras that the patient would need to be wearing. And we'll get into a little bit more of that in the upcoming slides.
Perfect. Thank you. Okay, so we mentioned the first 3 product features to look for. So the next 3 are look for products that have front closure or that are easy step-in bras. We have some bras that are specifically, you can step into them for ease of application and removal. You want to look for fabric-covered zippers so that it doesn't put any pressure on the skin or on any sensitive scar tissue. And also choose some soft and lightweight breast prosthesis so that it doesn't put an excessive amount of pressure on the shoulder or any other part, excuse me, or any other part of the body. So having said that, I will now pass this on to Jennifer and she'll continue on.
Thank you, Franz. So Linda, we're talking about pre-op and post-op garments, how to help patients manage the pain. And this is before the surgery takes place. That patients will want to go in and see a fitter. So fitters should be developing relationships with hospitals or various different organizations to inform them that it's important for patients to come in before the surgery takes place so they can get properly fitted for the right post-op bra garment. And as we mentioned before, any healing complications or excess scar tissue can lead to AWS or aggravate AWS. So we want to be sure that patients minimize those situations, which post-op garments will help. So these garments are typically worn approximately 6 weeks after the surgery takes place. They're important because they offer compression to help reduce any swelling from the surgery. They help to speed up the wound healing process. Not wearing a post-op bra can cause wounds to heal poorly and lead to healing complications. And as well, number 3 would be to reduce the scar tissue. Scar tissue from surgery can contribute to cording, as we mentioned, and that's because of any sort of shifting. You want to make sure that everything is compressed nicely. Any type of excess shifting that can cause hypertrophic scarring and excess tearing that takes place. So patients should be fitted prior to going into surgery so that they can have the garments available and provide them to the nurse so that they can be put on immediately after the surgery takes place. So in terms of our top selling compression bra in Canada, it's the 519. This helps to stabilize the breast tissue during the healing process, reduce any swelling, and maintain the breast shape post-surgery. This is made from very soft cotton blend. It's got adjustable panels. It's got a front closure with a zipper that's all lined nicely, so there's no irritation that's going to be caused from the zipper digging in or from the metal coming into contact with the skin. Wide elastic bands, and just very easy to wear, and it's important to come in before surgery to get fitted for these garments so that they fit your body and provide you with the compression and the support that you need during the healing process. These are also available in non-molded options for men who are going through chest surgery, or for women who are going for flat surgeries. Another great option is the 520 Active Recovery Bra. This one also has a front closure with a zipper at the front. Many people have issues after surgery with mobility, moving their arms and shoulder pains, understandably. So having a front closure is the best option. It's also got adjustable straps so that you can fit it to your body type. And it's a really lovely, breathable fabric. It's double layered, so you get the right support and compression that you need. For women who are looking for more coverage and would like something that's cotton, the 952 Zip Front Post-Surgical Camisole is a wonderful option for that. It's got the zip front. It also has detachable shoulder clasps. So some people who really struggle with arm mobility and shoulder mobility really like this option because they can slide it in and step into it. These garments come with two Velcro attachable drain pouches, and then also two puffs, as you can see on the bottom right-hand corner, which we call leisure forms. So you provide you with a little bit of shape during that post-op period. So for patients whose surgical sites have healed, but before they're ready for a full silicone prosthesis, we want to stress that the surgical site needs to be healed before any type of form or prosthesis is placed along the chest wall. Because once again, we don't want to have anything that's going to aggravate, cause healing complications, or potentially result in additional scarring or things of that sort. So you want to make sure that the surgical site has healed before we look at any of these options. So the active form is a good in-between option before a client is ready for a full silicone prosthesis fitting. These are really lightweight. They're made of microbeads. They're easy to clean, and they are very reasonably priced, so you don't need to worry about the additional cost of having a sort of in-between form. You can use them for swimming or active activities too as well. So it's something that you'll continue to use throughout your life. So we've got a few suggestions and recommendations for patients after surgery. So after the surgical site has healed, we want to make sure that we stress that. If the surgical site is not healed, you do not want to be recommending any of these products. And these are for patients who have what we consider more mild to moderate pain. So you're looking at, soft, comfortable fabrics. Everything is lined well so that nothing is going to cause any irritation, digging along the skin. So fabrics need to be covered, lined, and zippers need to be covered. And very importantly, it's so important to make sure that the patient, the client, has a supportive and properly fitted bra and breast prosthesis. If it's not fitted properly, it could rub, chafe, it could provide excess weight along the shoulders unnecessarily. So these things will all aggravate and cause more pain and discomfort. So it's so important to make sure that patients are properly fitted. And that will help in their journey and go a long way. So our top selling bra in Canada, this 525 massage bra is just so loved by Canadians. We literally can't keep it in stock. It fits almost everybody, and it's just the most comfortable bra on the market today. It's constructed with this textured fabric that's very cooling, and it's breathable, and it also has this massage-like feel to it. It's really well padded, so it provides great support, and it's just very comfortable. It's got good coverage under the arms, wide bands, and women just love it. Every time we come out with a new color, it's just gone right away. So this is always a go-to one if you have clients who are looking for something that's really comfortable. It's also seamless, so you don't have any stitching or anything that clients might not like. This is really sort of the go-to one that everyone should have in their collection. So for clients who are looking for something that's a little bit more elegant, especially if you have clients that are on the larger size, so any plus sizes, this is a go-to, the 511 Regalia bra. It's designed for optimal comfort and support. As you can see, got really good coverage under the arms, really great straps, and it's a 3-part cup. And it's beautifully designed with the floral and bordered detail. So it really adds a beautiful touch. Another great option is the 516 Silhouette bra. This one is made of soft foam, and it just flows very beautifully over all of your client's curves, and it smooths everything out nicely for a very polished look. You've got the contoured straps to give you nice support, and a nice mesh back to give you additional airflow. And all the cups are seamless. Canadian women love their seamless molded cups. And it's just very smooth, so it fits very nicely under your clothing. And in terms of a full silicone breast prosthesis, remember this is after the surgical site has healed. Our top selling breast form in Canada is the 10275 massage form, and it's made of the super soft silicone. Women love this because not only is it made with our lightweight silicone, which is approximately 30% lighter than the regular silicone, it's also made with a super soft silicone, which is very gentle. It hugs the chest wall beautifully. It also has the massage back, which are those channels that you see. So it helps to cool and reduce any heat. It's also got a bit of a fuller back, so it hugs the chest wall really nicely, and it's just very comfortable. It comes in both the tawny and the blush color, so it is great for women who have darker skin tones. And then for women who are struggling with weight and who want something that's very, very lightweight, that can be common, is the 10271 Classic Triangle Air. It's made of the ultralight air silicone, which is roughly about 45% lighter than the traditional silicone. So for women who really find wearing a prosthesis straining along their shoulders and back, this is a really great option for them, because this is the lightest full silicone prosthesis on the market. And some suggestions for women who have more moderate to severe pain. So that for those sort of very sensitive clients, you want for sure to get a front closure bra or an easy step-in bra, because they're going to really have very limited mobility to be able to lift their arms above their shoulders. Once again, you want soft, comfortable fabrics, lined cotton lining. All the zippers and areas need to be covered. We're looking at the lightest weight and the softest breast forms. And stressing again, make sure that they're properly fitted. Because when they're not properly fitted, similar to shoes, if you're not wearing the right size shoes, it's going to be very uncomfortable. You're going to have additional rubbing and movement, shifting, and things of that sort, which will really aggravate the area. So here are some front closure options, and front closure just really means that it opens at the front. Some of them open at the front and the back, such as the 123 front closure, so you have really good options there. You can either have a zipper or there's little clasps, depending on the style. So one of the most popular ones is the 110 leisure. So this is used either for a post-surgical garment or for patients who have a lot of pain and discomfort, mobility constraints. Also for leisure wear, just for people who enjoy wearing something that's a little bit more relaxed on the weekends or at night. It features the front closure, and it's got really wide straps, and it's made of cotton, so it's really nice, breathable fabric. You've also got the 952 zip front camisole, which we spoke to earlier, for patients who like additional coverage. I know a lot of women prefer to have some more coverage at times, so this is a great option for them. The 130 molded leisure. This is a cotton base too as well, and it's got a molded cup. So for women who want something that has a smoother appearance in the front, this is great. And it's also made of cotton with a little bit of spandex, so it's very comfortable. The 123 rose contour. This is one of our top selling front closure bras. So people who are looking for some more support, and it has both a front and a back closure. So you have some flexibility and options there. And it gives you a really beautiful shape and it fits nicely. And as well, the active recovery bra, which you spoke about earlier, is a post-op garment. A lot of women also choose to wear this if they're dealing with a lot of pain and discomfort because it's very comfortable. The fabric is extremely soft and it gives you really, really good support and coverage. And then a couple options for easy step-in bras for those who really just cannot just have really constrained mobility in the arm and shoulder area. We've got the 131 comfy bra. So this also has a back closure too, so you can use it as both, or it's made with really stretchy, soft fabric, so you could step into it. Similarly, the 136 on your right, the Comfy Classic, made of similar material, but it's got wider straps. It also has a back closure if you do require that. So for women who want a little bit more support, this is a great option. The 131, also you could take the straps off, so or use it as a crossback too as well. So there's some additional features there. And then the 952 zip front camisole. This one, as you can see, the clasps can be removed. So you can use it as a step-in if necessary. And then as well, you also have the zip front option. So in terms of recommendations for breast forms, features you're looking for are the super soft silicone, and then you'd like something lightweight. So a great option, depending on the profile and the shape of the patient, the 10248 triangle super soft is good for patients who have, you know, shoulder pain and are looking for maximum comfort. The dual layer silicone provides really ultra softness, so it hugs the chest wall very nicely, and it's also made with the lightweight silicone. Similarly, you have the 10373. This one's an average profile and a triangle shape. So you want to make sure that you're fitting the profile and the shape to the patient. So I'm giving you a few options here. These are made with triple layer soft silicone. So it also has a convex back, which allows it to fit very snugly against the chest wall, and a very natural silhouette. So if you have any pain or tension, this one will help with that. And then for clients who need something that's really lightweight, we have two options here. They're very similar, just different shapes. As you can see, one's a standard triangle shape. One is has a wider footprint. Different profiles. One's average, one's shallow, but they're both made of the ultra light air silicone, which is the lightest silicone that's available on the market today. And both of them have the massage back, so that allows you to encourage airflow, and it reduces heat retention. So it's not as hot. For clients who are constantly complaining about heat, these are the ones that you want to recommend for them. And then for your ultra sensitive patients who just cannot tolerate a full silicone prosthesis, we would recommend the 932 active form, so that they get some shape, but they have the comfort that they need. Any questions? I guess we should go back to Linda. You had talked about post-op garments. Are we referring to compression bras or compression arm sleeves? So just to clarify that, so regarding post-op garments, we want to make sure that patients are fitted for the compression bra prior to surgery, so that they are wearing that right after surgery. And we discussed the reasons why. We want to minimize any healing complications, and we want to minimize any potential scar tissue. The compression arm sleeve aspect of it, that's something that they'll need to discuss with their healthcare professionals after the surgery. If there's any sort of cording that develops further along the arm, that's something that needs to be addressed at that time. We also offer a mastectomy fitter training program. So if any of you are interested in signing up, it's free, and you can just go to our website and you can sign up at that time. And any questions, any feedback, if there's any other topics that you guys are interested in learning more about, please let us know. Education, as I mentioned, is so important. So you want to make sure that, we're continuously learning, and we're able to help service our clients and our patients to the best of our abilities, especially with so many changes in healthcare and different methodologies and modalities. It's always good to be up to date on what the most current sort of conversations are.
We have a question from Leslie. Says, I have a client who complains that the prosthesis ends up in the middle of her chest. She had a mastectomy. Do these prostheses stay in place? So it's not a question about the prosthesis. I think it's more to do with fitting of the bra, in my opinion.
Yeah, it sounds like it. In the middle of her chest. So it's shifting. So the prostheses need to be in the pocket. So I don't know if she's wearing a pocketed mastectomy bra. So patients need to be fitted for a mastectomy bra. And one of the features of a mastectomy bra is that there are pockets so that the prosthesis actually fits into the pocket. So it doesn't shift and it won't sort of move towards the middle of her chest. So that's one aspect. She needs to be wearing a properly fitted mastectomy bra. And then that should not cause, the prosthesis to shift in that way. Is that clear, Leslie?
I think also if the bra isn't of the right size or the prosthesis is not of the right size, you can encounter some issues with shifting and
Yes.
it coming into the middle of the chest. So maybe the bra is too loose or the cup is too big or some other issue like that.
Yeah, that's why it's important to go to a fitter who is trained, who's taken the fitter training, because they would be able to address all those issues. Um, any other questions while we have everyone on the call? Another point to add to Leslie is that for patients, some patients, especially in Europe, don't like to wear bras. So there are breast prostheses. ABC has a selection of them where they actually adhere to the chest wall. So if she, doesn't want to wear a bra, or if she wants to wear something backless, um, we have breast prostheses that adhere directly to the chest wall. So that's another option for her. If there's no other questions, I will let everyone go. Thank you for all your time today. If you do come across any questions that you might have, don't hesitate to reach out to us after the presentation. The team is very happy to help you. They're super nice and lovely people, so don't be afraid to reach out. With that, thank you, everyone. All the best. If you're in Ontario, I hear there's a big snowstorm coming, so please drive safely and take good care of yourselves.